We received a grant from the Office of Community Services Administrator, which is basically a job creation, but the focus is around, trying to solve some of the issues of food insecurity and where we have food deserts. And the collaborations that are formed by that, I think, is the key, because the job creation is by those businesses that have a need to hire people.
Gotcha.
And the program is helping support the training and giving incentive to the individuals while they're going through the process, with the companies then committing to hire the people for a period of time after that.
Gotcha.
So it is a partnership that I think that is the best way for us to go in this kind of environment where dollars are becoming less.
Does CETA have occasion to interact with the business community or small businesses in Cook County?
Oh yes, for a number of years we have been doing a number of things in economic development, including working with small businesses through loans and job creation. But we also participate with chambers of commerce. We're part of the Workforce Investment Board, where the private sector sits on and actually directs that. So there's a lot of interaction and partnerships formed through that process.
I know one of the things that we try to break down the federal alphabet, and we hear the term WIC. Can you help our viewers appreciate what WIC is?
Well, WIC is a nutrition program, but its name is Women, Infants, and Children. Okay. It's a nutrition program helping mothers, even in the prenatal school, to make sure that their nutritional needs are met, and children, they can identify deficiencies in nutrition, things of that sort. So it's really important for healthy babies.
Okay. I see we're going to need some time, Q, so I may want to make sure we touch on the broad challenge that CETA sees in terms of at the national level right now. What if some of these dollars, the CSBG dollars, goes away? How does that affect the programs you're currently delivering?
I think Sandra would agree it would have a tremendous impact on community action and community action agencies, because basically, and the terminology is sometimes frowned upon, it does serve as a kind of core funding that allows us to bring people together through our tripartite board and to communicate with major institutions in the community. It allows us to plan. It allows us to have a capacity that we would not otherwise have, because our special emphasis programs don't allow us to do all these other things. So it's the local initiative that is needed in communities today, where we have so many people that are coming into, need of the services at a time when the resources are becoming
You
less.
use the term tripartite. Can you help some of us who might not know what that means?
Oh, okay, I am. We are required to structure our board in terms of the public, private, and those who benefit from the program. Could be recipients or advocates of persons who are eligible to receive our services. And so that's how our board is made up. By law, we have 1/3 public. We have not less than 1/3 coming from the community and those who benefit, and the remaining number comes from the private sector in areas that would be helpful to assist our clients.
So you actually got regular people who need services sitting down with people who create the laws about those services and the business community that help make it happen in one place at one time.
Exactly.
Yes.
Is that unique to just CETA?
Oh, no. Our agency, and I'm not sure we even mentioned that, Tri-County Opportunities Council.
Okay.
We, too, are governed by that same statute. And even to go a little further now, because of the Head Start Act, we have to have certain folks that represent parts of the Head Start program or people that would be served by them. So it's gone even a little bit beyond that. But the tripartite board is very unique to community action, and it does. The idea is to focus all elements of the community on the problems of poverty.
Does that come in handy when you have resource needs and people are sitting there? Some might be sitting on resources.
Oh, very much so.
Of course.
Very much so.
You know, I can cite numerous examples of how, for example, a community, take Schaumburg, has used its community development block grant money to help us purchase a Head Start facility.
I'm looking at a red light, and that red light says, hold it right there. We're going to have to go to break and pay some bills.
Thank you.
We'll be right back with
Thank
more
you
right
for
after
having
this
us.
commercial message, okay?
Do you know who we are? PCCEO, helping people, changing lives for every stage of life.
Early childhood programs, child care assistance, prenatal care, children's mental health services, and after-school programs are all greatly impacted by the state's budget crisis. In 2010, 1 in every 5 Illinois children are living in poverty. Peoria County, that number is 23% of all children in Peoria County live in poverty, with a statewide average of 19%. Racial, ethnic disparities in family income have widened, within African Americans and Latinos having the highest child poverty rates in the state of Illinois.
Let me share with you a sobering statistic, and actually Cleet mentioned this as well, that 1 in 5 Illinois children live in poverty, and more than 33,000 homeless children were enrolled in the state's public school system. Again, 20% of our children in the state of Illinois are living in poverty.
But I've been asked to highlight a major reason that children are living in poverty and what happens to these kids. Domestic violence is a major reason that children are poor and are homeless. Several studies show that 50% of all homeless women and children are in that situation because they have fled a domestic violence situation. Now, even though domestic violence cuts across all socioeconomic lines equally, because there are a lot more poor people than wealthy, the gross numbers of low-income women who are domestic violence victims is very high.
We're back, just like I promised. And we have some new friends joining us. Mr. George Brown from Rockford.
Davis, yes.
I'm sorry, George Davis. And we have Donna Moulton from DeKalb. We're here at the Association's Winter Conference, and one of the things that's been a theme is the challenges that's on the horizon and in your local communities. Let's talk a little bit about your program, George.
Well, you know, we are the community action agency that serves Boone and Winnebago County, Rockford being the largest metropolitan area, and the challenges in Rockford, I think, are similar to those in the rest of the state and the country, having to do with increasing rates of unemployment, which have not come down significantly, significant foreclosures on houses, and families just having trouble meeting their basic needs. all over the community at the same time when our resources are declining. So, you know, again, this is a story I think that many communities can relate to right now. And our role is to figure out how we make the most effective use of our limited resources, but also how we grow new resources and get new partners and partnerships that will allow us to really impact trying to address those basic needs, and as well as help families really continue to have any hope of moving out of poverty.
Can you help our viewers by describing or sharing a particular program that you currently administer?
Well, you know, one of the programs that we are most proud of, you know, because we administer a wide variety of programs all the way from basic direct assistance to clients, anything from helping with a car repair for a family that might have to get to work and cannot afford to you know, a lot of other basic needs services, housing services, community health and prevention around helping youth to avoid risk-taking behaviors, Head Start, early Head Start programs, weatherization, energy assistance. But in all of that, one of the programs that we are most proud of in the last few years is our Community Gardens project, in which we were able to invest in a relatively small amount of money that has paid dividends to the community. We started with about 9 community gardens 3 years ago, and then that ballooned and really to 45 community gardens the following year. That was thanks to the fact that we had this additional funding through ARA, through the stimulus funding, that allowed us to invest more in community gardens. Well, even though the stimulus money is no longer here, those community gardens have not only been sustained, but have continued to grow and become parts of neighborhoods. And they've actually seeded collaboration and energy around neighborhoods really coming together around growing food together, you know, actually taking some of the food that's grown and giving to local food pantries, being able to use that as a basis for community organizations to get people to come out of their houses and get to know each other, improving the nutrition in food desert areas of the community. All of these things from a really relatively small investment that we continue to see benefit to the community for.
Kind of consistent with Michelle Obama's let's move, healthy eating kind of thing.
That's correct, because we know that, of course, in low-income communities, that, you know, nutrition and the fact that we have these food deserts where families cannot find affordable you know, food or healthy food within a reasonable distance of where they live, and then added to the transportation issues. This becomes a real key thing in having healthier children, healthier communities, to have high quality fresh fruits and vegetables, and then canning has now become a thing. There's also now a movement to create a community-wide market that would allow locally grown foods to be sold by local farmers and local neighborhoods that are growing vegetables and so forth. So this has become a real movement in our community.